If you're an older man who still masturbates, I need you to hear this because there's something almost no one tells you. In fact, it may be the one thing that's quietly making your erections weaker, your sensitivity lower, and your confidence fade. Not because you're doing it, but because of how you're doing it. My name is Dr. Elena. I've spent the past 30 years helping men over 60 reclaim their energy, intimacy, and strength. And I can tell you, this is one of the most common, yet least understood issues I see every week in my clinic. Most men believe masturbation is either good or bad, black or white. But the truth is more complex and far more important than you think. Because while self-pleasure can support your health, it can also slowly chip away at your performance, your hormones, your circulation, and even your connection to others if done the wrong way. In this video, I'll walk you through the 10 hidden risks of masturbation after 60 that most doctors never explain, and how to turn this private habit into a tool that actually protects your prostate, improves blood flow, strengthens testosterone, and enhances intimacy. Before we get started, if you haven't subscribed yet, go ahead and tap that button and turn on the bell so you never miss important health insights made specifically for men in their 60s and beyond. And if this video speaks to you, type 1 in the comments. If not, type 0. I value your feedback and it helps me create content that truly serves you. Risk number 1, social isolation. I remember sitting across from a patient of mine, a retired high school teacher, 67 years old. He had that quiet look in his eyes, the kind of heaviness that doesn't come from age, but from being unseen. After a few minutes of small talk, he leaned in and said, "Doc, I haven't touched another person in months, but I still take care of things on my own. That bad?" That question stuck with me, not because of the act itself. There's nothing inherently wrong with self-pleasure. In fact, when it's done with intention and balance, it can be a healthy part of a man's sexual life. The problem is, what happens when it becomes a replacement for intimacy rather than a support for it? Many men in their 60s, 70s, even 80s find themselves drifting into quiet routines. A solo release becomes a comfort, a habit, a way to feel something even for just a moment. And slowly, without realizing it, they stop seeking connection with others emotionally, romantically, even socially. Masturbation fills the gap until the gap becomes a canyon. It's not just about sex. It's about the subtle, painful withdrawal from life, from hugs, from laughter, from eye contact, from feeling seen as a man, not just a patient or a pensioner. I've seen men lose the desire to date, to touch, to engage, simply because solo pleasure became easier than facing the vulnerability of real connection. And here's the truth that few will say out loud. Physical touch is more than pleasure. It's medicine. It's what keeps your emotional circuits firing, your testosterone engaged, and your sense of self-worth alive. When you stop reaching out, your world starts shrinking. Risk number 2, skin microlesions. Not long ago, a patient in his early 70s came to see me with a concern that he felt embarrassed to even mention. He said, "Doc, I've noticed irritation down there after and it's been happening more often lately." Here's the truth. The skin of the penis, especially as we age, becomes thinner, more delicate, and slower to heal. The body loses some of the collagen and elasticity it once had in youth. Combine that with decades of friction, and it's no surprise that many older men develop what we call microlesions, tiny tears or abrasions in the skin that can happen during masturbation, especially when done too aggressively or without proper lubrication. Most men don't even notice it at first. A little redness, a mild sting afterward, maybe a slight sensitivity for a few hours. But over time, these repeated micro-injuries can cause inflammation, irritation, and even scarring. They can make sensitivity worse, not better. And in some cases, they open the door to infections, bacterial or even fungal, that thrive in warm, moist environments. So, what can you do? First, be gentle. You're not 25 anymore, and that's not a weakness. It's a reason to treat your body with more care and respect. Second, always use a good quality water-based lubricant. A proper lubricant reduces friction, prevents tearing, and actually helps preserve sensitivity over time. Third, slow down. You're not racing the clock. This is about connection, not completion. Risk number 3, desensitization. He was 64, sharp-minded, healthy, still working part-time, and yet he sat in my office looking defeated. "Doc," he said, "I can't feel anything like I used to. I can get there on my own, but with my wife, it's different. I don't know what's wrong with me. I see this more often than you'd imagine. And it's not always about low testosterone or circulation. Sometimes it's about what I call the quiet conditioning of the nervous system. You see, when a man masturbates in the exact same way over and over, same grip, same rhythm, same pressure, same fantasy or screen, the brain and body begin to associate pleasure only with that specific pattern. In sexual terms, this is called desensitization. And for men over 60, it often shows up as difficulty feeling arousal with a partner, needing more intensity to get the same result, or struggling to climax without recreating a very specific solo environment. But it's not a moral failure. It's not even a medical one. It's neurological conditioning. And the good news is, it can be unlearned. Start by changing the way you touch yourself. Vary the speed. Change your grip. Explore different positions. Try engaging your imagination rather than relying on external stimulation every time. And most importantly, slow down. Your nervous system is not broken. It's just been overtrained in one direction. What it needs isn't shame. It needs patience, permission, and time to reset. Risk number 4, masking erectile dysfunction. I once had a man in his late 60s come see me after putting it off for almost a year. After some gentle conversation, he finally admitted, "I can get hard when I'm alone, Doc, but with my wife, it just doesn't happen. So I've stopped trying." That moment was heavy. Not because he was broken, but because he didn't realize his body was sending him a warning. What he thought was a minor intimacy issue was actually the early signal of something much deeper: possible vascular disease, blood sugar imbalance, or hormonal decline. Here's what most men don't know. The penis is like a barometer for your cardiovascular system. When blood flow slows down, when arteries become less elastic, when hormone levels drop, or nerve sensitivity fades, your ability to get and keep an erection with a partner is often the first thing to change. But because masturbation is usually easier mentally, emotionally, and physically, many men assume everything is fine. They're still functioning, just not there. But that assumption can be dangerous. Masturbation can sometimes bypass the deeper issues. If you notice a pattern, erections that are less firm, that don't last as long, that disappear with a partner but stay during solo time, that's not something to ignore. That's something to explore with a trusted physician. Risk number 5, nerve compression from poor posture. A few years ago, I met a man in his early 70s. He came in complaining of a dull, persistent numbness around his groin that had slowly gotten worse over the past 6 months. But after a full evaluation, I realized it wasn't vascular. It was neurological. The culprit? Something deceptively simple: how he was sitting. What most men don't realize is that posture, especially during masturbation, plays a major role in nerve health. Many older men spend more time seated in recliners, office chairs, or hunched over in quiet privacy. And while that might seem harmless, the pressure from sitting on hard surfaces or in a slouched position can slowly compress the pudendal nerve, the nerve responsible for sensation in the penis, perineum, and surrounding pelvic floor. Over time, that compression can lead to numbness, tingling, loss of sensitivity, and even pain during or after sexual activity. But the good news is, once you understand it, it's easy to correct. Avoid masturbating while sitting on hard chairs or slouching forward. Instead, choose a reclined or lying down position where your spine and pelvis are supported. Risk number 6, using it as your only emotional outlet. A man in his late 60s once sat across from me and said almost in passing, "Some days I just get tired of feeling things. Masturbation helps me shut it off." He wasn't talking about lust. He was talking about loneliness, about stress, about boredom, about that dull ache in the chest that builds when no one calls, no one checks in, and the days all start to feel the same. And I understood him because for many men over 60, especially those who are retired, widowed, or living alone, masturbation becomes more than physical release. It becomes a kind of escape, a way to regulate emotions that feel too heavy to carry. The truth is, Self-pleasure can temporarily reduce stress by lowering cortisol levels. But when it becomes the only emotional outlet, it can slowly turn into a form of avoidance. Instead of facing the deeper feelings, sadness, grief, frustration, even restlessness, you numb them with sensation. If masturbation is the only lever you're pulling, it may be time to expand your emotional toolkit. Start with small steps. Talk to someone, a friend, a counselor, or even a support group. Move your body, get outside, create new routines that involve more than just solitude. Risk number 7, guilt or shame. He was 72, a retired pastor, soft-spoken and thoughtful. And then he said something I'll never forget. "Doc, I still do it sometimes. And afterward, I feel like I've done something wrong. I can't even look at myself in the mirror." That kind of quiet shame runs deeper than most men realize. For many men of the older generation, especially those raised in deeply religious or traditional households, masturbation was framed not as a private act of self-care, but as something sinful, weak, or perverse. Those messages stay with you long after you stop hearing them. Here's what I want you to hear clearly. There is nothing shameful about tending to your own body. There is nothing immoral about wanting pleasure, comfort, or connection. Masturbation, when done with respect and awareness, is simply one way of caring for your physical and emotional health. But if you've carried guilt for years, even silently, it can have real consequences. Chronic shame can increase cortisol, disrupt your nervous system, and even diminish your body's capacity for pleasure. So, what's the first step toward healing? It's not changing what you do, it's changing what you believe about it. Risk number 8, pelvic congestion. Not long ago, a man in his late 60s came to see me with a strange complaint. He said, "Doc, I don't know how to describe it exactly, but there's this dull, heavy ache down there. Not sharp, not unbearable, just constant pressure." When I asked about his habits, particularly how often he was ejaculating, his answer gave me all I needed to know. After retiring, he said his days got quieter, and to cope with boredom and stress, he found himself turning to masturbation. Not once in a while, but 2, sometimes 3 times a day. What he was experiencing is something we call pelvic congestion, a buildup of blood and pressure in the pelvic region due to repeated, frequent stimulation without adequate recovery time. When ejaculation happens too often, especially over an extended period, the tissues and blood vessels in the pelvic floor can become irritated and inflamed. Your body, especially as it ages, needs recovery time. Most men over 60 do best with a few days between sessions. Not because more is wrong, but because recovery is just as important as activity. Risk number 9, potential impact on semen quality. He was 61, newly remarried, and full of quiet excitement when he walked into my office. "My wife and I have been trying for a baby," he told me. After reviewing his labs and lifestyle, everything looked fairly solid. But when I asked about his ejaculation habits, he paused. "Pretty often," he said, "every day, sometimes more." While frequent ejaculation isn't harmful to most men, it can temporarily reduce semen quality, particularly sperm concentration. Research has shown that an abstinence period of 2 to 5 days before attempting conception tends to result in the highest sperm concentration and motility. If creating life is still something on your heart, or even just a possibility you want to preserve, then consider adjusting your routine. Give your body time to prepare, to rebuild, to deliver what's needed when the moment is right. Risk number 10, disconnection from reality. I once spoke with a man in his early 70s who shared something with remarkable honesty. "It's not that I don't want intimacy with a partner," he said. "It's that real life just doesn't do it for me anymore." What he was describing wasn't erectile dysfunction. It wasn't low testosterone. It was something more subtle. He had unknowingly trained his brain to respond only to fantasy, to the curated intensity of pornography. And over time, real-life touch, scent, voice, emotion, it just couldn't compete. For men over 60, this risk is especially real because as life slows down and loneliness sets in, the temptation to escape into a digital world can grow stronger. But here's the good news. This kind of disconnection is reversible. Your brain is plastic, which means it can change. You can retrain it. Start by taking breaks from artificial content. Replace it with memory, with imagination, with real human contact when possible. Give yourself a chance to rediscover the slower, deeper layers of intimacy. Conclusion. So now you know masturbation after 60 isn't good or bad. It's not black or white. It's a tool. And like any tool, how you use it determines whether it strengthens you or slowly wears you down. We've talked about 10 real risks, from social isolation and desensitization to nerve damage, guilt, pelvic congestion, even disconnection from reality. These aren't meant to scare you. They're meant to wake you up, to give you the awareness and permission to take better care of yourself. Because this stage of life isn't about giving things up, it's about doing them differently, with more intention, more care, and more wisdom. Your body still responds, your desire still matters, and with a few small shifts, your private habits can become a source of strength instead of shame.